Hey guys, Mayo Factor Project checking in today. Dr. Tice here. So let's talk about self-responsibility. I think this is a gateway. Actually, this is a desired outcome that I think is a gateway that gets a lot of the guys into the clinic. And I noticed this trend. I don't know, something happened a year or so ago, and you know, with me personally, I started getting and seeing a different kind of a patient population that was finding their way into the clinic. And historically it had been basically baby boomers trying to recover their health from a life of like terrible lifestyle, and we still get that, and that still is definitely out there. But what we're talking about now is this new generation, and a new generation of empowered people. You know, historically, kind of stereotypically, I think you know, it was, you know, the females and the female demographic that was more interested in health and things like that. And I just think that that's like, oh, I don't know if that's just some kind of old programming or something, but that's not real life. You know, what I'm seeing is a whole generation of guys, of men that are tuned in. And that's really what the male factor is. The male factor is, yes, one of the things that we specialize in clinically is, you know, getting that second opinion, getting that second glance through a different lens to try to properly assess and get a good diagnosis on a male factor infertility, specifically either you know, some kind of unknown male factor or idiopathic unknown, basically undetermined male factor. Yes, we can unpack that. But inside of that, and nestled inside of that, is the greater issue of just the men's health and cultivating a sacred man's perspective and taking that responsibility where we're actually taking care of ourselves. You know, I think some kind of switch gets flipped in. I think this is biologically probably deep in the brains, deep in the conscious structure, where it's kind of a preservation thing that kicks in, but we start seeking out ways to take better care of ourselves. And once you reach that point where you are actually starting a family and creating that next generation, or even having that intention, there comes this kind of self-responsibility there where it says, hey, you know what, I'm going to man up and start taking care of myself. I'm going to start eating better. I'm going to quit doing you know, all the crazy shit that I did when I was in my 20s and all of that kind of stuff. You know, you kind of evolve and we grow up a little bit, you know, and this is a journey. You know, personally, I'm on this journey, and personally, you know, and clinically, professionally, that's what I know a lot about, and this is what I've seen, you know, really in, you know, the male factor. The bigger project of the male factor is the sacred masculine, and bringing that and birthing that forth. And we definitely, you know, we need to have that balance in our lives and in our world and in our health, so we can set those good models and set, you know, be a good role model, set those examples. Now, whether that's going to be for our own immediate nuclear family, or if it's just going to be for you know, maybe other people, maybe you know, maybe you're an aunt, maybe you're an aunt, or maybe you're an uncle, and you know, or whatever, you know, in the kind of extended family, and being, you know, you're going to step up and set a good example as far as like taking good care of yourself and feeling good and looking good and having good energy. You know what? Guess what comes with taking care of yourself and eating better and you know, and cutting back and cutting out all of those detrimental habits, drinking too much and smoking and, you know, all the things like, you know, maybe, okay, sometime in some part of your life you do that, but eventually you outgrow these things. You should outgrow these things. You need to mature. And now with that maturity and with that self-responsibility, there's a peace of mind that can be found there. And I think this is speaking to probably one of the underlying issues of the male factor, is the anxiety and the stress and the depression and the just craziness that people have in their minds, because everybody's basically some variation of schizophrenic, you know, trying to reconcile basically multiple personalities, that one part of you wants to do this while the other part of you wants to do that. And we got to reconcile that. So with the male factor, with nurturing the male factor, which is the sacred male essence, which is dialing up your game and manning up and taking responsibility for yourself, we're trying to smooth the ride out so the mind calms down and we can enjoy the ride a little more and create happy, healthy, vibrant, vital families. So that's the download for right now. You guys have a beautiful day. Adios for now.